Welcome to 3IE's Evidence Dialogues interview series, where we hear the thoughts of prominent leaders and influencers in the field of international development and pose key questions to them about the role of evidence-informed decision-making and their own evidence journeys. In this episode of 3IE Evidence Dialogues, we will be speaking with Joel Spicer, President and CEO of Nutrition International. Hi, Joel. Good to see you again. Our first question for Joel is, which interventions do you think are the best bets now for making progress in nutrition in the years ahead? How do your thoughts on that relate to Nutrition International's concept of low-cost, high-impact intervention?
Great. Thanks, David. First of all, thanks for having me here, and thanks to 3IE for hosting this really important series. I think we have to start with why nutrition is in and of itself a best bet in development. As we know, it's essential to have a strong immune system, which is how we fight infectious diseases and sickness. It's essential for brain development, which is required for kids to learn, to be productive, to help escape from poverty. And so the problem we're really trying to solve here is preventable child and maternal mortality and morbidity and lost human potential. And we're trying to solve for that within a resource-constrained environment. So in nutrition, we've got time-bound impact targets heavily based around evidence, around reducing stunting, wasting, low birth weight, anemia, and increasing breastfeeding. And they're all due in 2025. So if we focus and invest in proven interventions backed by evidence, we're going to move much more quickly towards that goal. And you'll see this is kind of a recurring theme in my remarks, the need for focus. But in terms of nutrition best buys, when I think of some key meta-analyses or seminal moments where evidence has come to the fore and really carried the day, I think about the Lancet series in June 2013, which looked at 10 evidence-based, low-cost, high-impact nutrition interventions. And this was heavily influential. In a way, that same year, 2013, that was a high water mark for nutrition, because Nutrition for Growth came out in the UK. That was a summit that focused on nutrition, generated additional financing, and led that evidence into a pathway for action. That will be another recurring theme. Why have evidence unless you take action around that evidence? And there's a big gap there too. So at NI, we believe that the prioritization of low-cost, high-impact interventions is essential, and that those particularly preventive interventions that create and preserve the most health and development should be scaled up first with a laser-like focus. And if there are scarce resources, which there always are, we've got to put the nutrition best bets first. But to me, the most compelling reason for why we have to invest in nutrition is actually the increased return you get in other sectors. And this is perhaps the path ahead of us in the years to come, where evidence can make a really important contribution. So if you don't invest in nutrition, we know you're not going to get the education outcomes that countries need in order to develop and achieve their national aspirations. We know that their health budgets are, and we're seeing it too in real time, health budgets are increasingly being spent on treating disease instead of on creating health and preventing that disease. And so insufficient awareness and priority for nutrition and insufficient awareness of the evidence that already exists is actually bankrupting health systems around the world. And it's kind of a truism. We all know this, but it's very clear that the path out of poverty will be walked by a well-nourished, healthy, and educated population who earns more, who pays more taxes, and contributes to that country's ability to make their own investments and scale up those investments in education and healthcare. So I'd like to just double click on two specific examples of nutrition best bets in the nutrition portfolio, and two that stand out for both their cost effectiveness and for their impact. And they're particularly important now, after several years of COVID, after a fuel, fertilizer, and food crisis, which has led to a malnutrition crisis, where a lot of the people living in high situations of vulnerability, particularly children, are already on their back foot in terms of immune system strength. So whatever we can do to reinforce, to come alongside and support that immune system health is really going to pay off. So the first is vitamin A. As you know, vitamin A deficiency is a significant public health problem globally, affecting more than half of all countries in the world. It leads to blindness, hearing loss, weakened immune systems, as well as sickness and death from preventable diseases like measles and diarrhea. Diarrhea, of course, is also a contributor to stunting. So vitamin A supplementation, which has got to be one of the lowest cost, highest impact interventions in nutrition, is a proven evidence-based solution. We have decades of evidence and meta-analyses. And the cost to produce a capsule is roughly 2 cents. The cost to deliver that capsule is roughly $1 to a child, and you need 2 capsules per child per year. If you do that in areas of high preventable child mortality, you can cut that mortality by up to 12%. And that's extraordinary for something that's so cheap. Everyone that needs it should be getting it, but they're not. And so I think from a Nutrition International point of view, that's one of the reasons we're all in on vitamin A. With funding from the government of Canada, who's been a consistent leader in this space, and increasingly from new emerging organizations like GiveWell, we're working with partners like UNICEF and Helen Keller International. But we provide the full supply of vitamin A capsules to more than 55 countries each year. And we also support governments with technical and financial assistance to scale up vitamin A, such that 150 million children are reached with 2 capsules every year. To go to one more example where I think much more can be done and where the evidence is strong enough and the urgency great enough for us to do more, that's large-scale food fortification. So when you think about it, large-scale food fortification, we're talking about wheat, rice, cooking oil, for example. It has such potential to reach massive amounts of the population because it's fortifying staple foods they already consume. In 2008, for example, staple food fortification was ranked as a top 3 international development priority in terms of cost benefit by the Copenhagen Consensus Expert Panel. We're really talking about pennies per person per year for something that has high impact. And by impact, the evidence shows that you can cut anemia by up to 40% when you fortify with iron in areas where there's high iron deficiency anemia. And just to give an example from my own country, in Canada, when we instituted mandatory fortification with folate, for example, neural tube defects amongst children dropped by almost half. So we're talking about a very potent intervention here. And it's almost irresponsible that it's not at scale in many countries. So it's exciting when we begin to advance, when countries hear the message, when they begin to take that on as national priorities. One of the reasons we're excited about this also is because when you do large-scale food fortification, you have an opportunity to target social safety net programs. And as you know, and as we've discussed in the past, the expansion of social safety net programs in response to COVID has been extraordinary, and more than 1.8 billion people. And yet they're not optimized for nutrition outcomes. So one of the things we're doing in terms of the evidence domain that we're really excited about is working with our partner IFPRI to look at all the social safety net programs, all the social protection programs that have tried to have nutrition impact, the ones that have failed, what they did, the ones that succeeded, why, and pull that together so countries aren't inventing in their private solitudes new approaches that may or may not work. But how can we increase that baseline level of knowledge and influence a massive platform? And again, that's why Nutrition International is all in on large-scale food fortification. That's why the Gates Foundation is all in on food fortification and is making a major push in this area too. We're very happy to share with you that this last year, we reached over 250 million people with fortified food staples last year alone. And that means supporting governments financially, technically, on regulatory and legislative pieces. And using evidence in a smart way is the best possible way to advance that case.
Great. That's really complete and compelling. And you've already brought up the question of evidence, so let's drill down a little bit more on that in the next question. How important is the availability or lack of reliable evidence in influencing the thinking and the actions of you and others in recommending and supporting policies and programs aimed at improving nutrition in low and middle income countries? What are your priorities for where more good evidence would help in the coming years? And are there some concrete examples that stand out for you?
Thanks, David. I hope I don't go off on too much of a tangent here because this is something I think a lot about. And in my way of thinking, I alluded to it earlier. I guess it's not just having evidence, but it's whether we use the evidence we have as well. And I guess if we use the evidence we had in the world, it would look quite a bit different today. We'd prioritize investments in preventive health and education in all countries, and good nutrition for all would be a standard operating procedure. So I'm concerned not only about how to get more of the right type of evidence, and when I say right type, I mean the kind that helps unblock the path to scale. And we need a lot more data as well. You've referenced data too about the population we serve, the real-time magnitude of the problem we're trying to solve, the location of greatest need within a country at subnational level. So there's some positive moves in that direction, but a long way to go in nutrition as well. But I'm particularly concerned about how to get the evidence to decision makers who are not technical by and large in that domain. They may be technical in other domains. And they need to understand the problem we're trying to solve in terms of human damage, what will happen if they do nothing, also the human benefit, and what it will cost, how much it will save, this kind of element. So putting evidence into action through evidence-informed advocacy seems like a really important hurdle that the nutrition community has to get over. And there have been some good examples where we have and others where we haven't. I see a couple of challenges in this domain in terms of how evidence is used or not used in nutrition to impact our efforts to go to scale. So I talked about focus earlier. I'm going to come back to that now. We need to focus on the lowest cost, highest impact, evidence-based nutrition interventions first. And it doesn't mean we shouldn't look to the future. It doesn't mean we shouldn't try to see the big picture or solve climate change and the food systems problems and their relative contribution to malnutrition. But we have to be able to walk and chew gum at the same time. That means we ought to be able to focus and hold high what we know will work and create the greatest good for the greatest number now and in the medium term, while exploring new pathways forward as well. But the reality is shifting priorities, different agendas. Sometimes I would call it a fetishization of the new and innovative for its own sake. It can also cause a loss of focus in scaling up what works and in getting the job done. So donors, for example, particularly major donors, should have a focus on measurable results and impact. It sounds redundant that I would say that because you would assume they always do, although when you lift up the carpet, you find that it's actually inconsistently applied, right? Donors should be dogged in their pursuit of value for money, especially now when there's so many domestic pressures in donor countries. I don't believe donors are assessing and comparing their portfolios on this basis as much as they could to get more value for the money they're putting on the table. And they can't be really from a nutrition point of view when you think about it, because malnutrition contributes almost half of all preventable child deaths. And yet globally, donors spend about 1% of ODA on it. So there's clearly a mismatch there where we're not listening to the available evidence. And that question, cost effective compared to what, is a question I'd like to hear a lot more of. Lots of things are actually considered by the definition cost effective compared with not doing them. But compared with other things you could do with the same money, that's quite a different decision framework. And I think we've got to make some hard choices on the road ahead. I am really energized by and excited about new emerging donors from the effective altruism movement, like GiveWell, for example, who are really leading a new and renewed charge in this domain. That call for evidence and a rigor in evaluation around that evidence, because they really want to do the greatest good with the funds on the table and to be able to say that they are doing so. So that means they are, by definition, pushed towards the lowest cost, highest impact interventions with the most solid evidence base. If we did this, if more donors followed this approach, we would save and improve millions of more lives with the same money that we're putting on the table right now. So it's not just more money for nutrition, it's more nutrition for the money, as the old saying goes. I just want to give you one specific example, because you've asked the question, where would I wish for there to be more evidence? And really that list is so long, we would need a whole day to talk about it, David. But one thing I'm excited about is a study that we've just completed the first phase of with the Harvard School of Public Health called the IGNITE study. And this is an example of how if you target questions at the spaces in between sectors that are separate, you can sometimes unlock silo breaking opportunities that create greater good for the people you serve. Because there's often a kind of monotheism when you come from a certain sector. You don't look outside and ask yourself, could I help more people if I listen to this person more? But here's the example. So the non-communicable disease community and the nutrition community are actually fighting the same fight, but they're not really joined up the way they should be. And the question we were pursuing with Harvard was, what if you scaled up multiple micronutrient supplements iron, folic acid, calcium supplements for the pregnant woman. What effect would it have downstream on their children when they grew into adulthood? So that's looking a little bit far ahead, right? And we know that there's going to be an impact on the life of the mother. We know there's going to be an impact on the life of the newborn. That's very clear. The evidence is there. But when we pulled together with them the causal pathways, when we looked at the state of evidence, what was plausible to say, what was not plausible to say, it turns out that downstream for those children, if you intervene with the mother, their risk of non-communicable diseases, of becoming overweight and obese, drops significantly to the point where you can measure the number of diabetes cases averted. Now, that's extraordinary because from the nutrition side of the fence, we've never been able to say what our contribution is or quantify it specifically to the NCD fight. And if you talk to many of our partners in countries, many government officials or decision makers there are a lot more funerals they're going to from relatives and friends that have died from non-communicable diseases than from undernutrition. So that is the pathway to talk to them in many ways, I think, by bringing those two communities together. So some nutrition interventions are not just best bets, but they're triple word scores. And we really need to focus on that as well.
Great. Thanks, Joel. Very, very compelling. And let's drill down a little bit more on the siloed approach question. You've already nicely brought up the problem that the siloed approach development is one of the greatest drivers of missed opportunities. What do you think could be done to break down those silos? And what impact do you think that could have?
Thanks, David. That's a good question, and it's a hard question, but it's close to my heart. I think over the course of my career, I've been increasingly troubled by the fact that many of the institutions I've worked for, they structure and they finance massive missed opportunities factories for the people we serve. I'd like to share just two brief stories about that. So the first one is when I worked for the World Bank in Africa, Health, Nutrition, and Population. I was one of the few people working on tuberculosis. I was an infectious disease before nutrition. There was a very, very large team across the bank working on HIV/AIDS operations, and there were many. So I had to review a lot of HIV operations. Often, and good to keep in mind, tuberculosis is the leading killer of people with HIV. I would sometimes do word searches on like 180-page documents for TB, and the word that would pop up the most would be textbook, because there's a T and a B in textbook that are close to one another, but not tuberculosis. And so there was clearly something wrong there, I think, with the way that we look at what affects people, how it comes together in people. Often, to a man with a HIV, malaria, nutrition hammer, every problem looks like that kind of nail, right? And that's problematic because that's not how the world works. And that came together for me and punched me in the heart on a trip to Swaziland. Again, working with the bank. I went with a government team out to look at multiple drug-resistant tuberculosis and some TB patients who were being cared for at their home. And there's a fellow called George Mashaba. We rolled up in a minivan with people from the capital 3 hours away, and it looked to them like they were stepping out of the minivan onto Mars. So surprised were they by the conditions around this village. We went to George's house, and George was in advanced HIV for a long time, TB for a long time, advanced AIDS. He greeted us wearing a pair of trousers with string keeping it up. Skin was literally falling off his body, teeth were out. But so it's a bit shocking if you haven't seen someone like this first. But he painfully got up, welcomed us with great dignity, shared his time with great dignity. When we asked him what the problem was, and we were there because we were interested in his TB, maybe not him as much as we should have been, but we were TB people looking at TB. This is the problem I'm trying to get at. We asked him what his problem was, and he said water, which blew our minds because the area was a drought, and food because he couldn't take his meds because he didn't have enough food. And I left that thinking how ridiculous we are when we leave with this tick box of the thing that we're interested in. And if we tick that box for that thing and we walk away and they die of something else, it's of no interest to us or consequence to us. How broken is that system? I got a text message as I was getting on the plane less than 24 hours later that he had died. And so that left us a very strong impression on me. And that's why I will never forget his name. But it made me concerned that we're looking at things in too siloed a way. And having worked as a donor in my first job, I know that donors are structured in many ways that inhibit digging into the spaces in between, right? So education, we talked about, or SRHR, those units are often not in the same place, or nutrition. So they treat their problems separately. They seldom get together. They tend not to incentivize in their partners the coming together. That's where evidence can play a hugely transformative role. Just to give you one example, at Nutrition International, we're excited about working with schools to target adolescent girls who suffer very high rates of anemia, up to 70% in some cases, which is crazy. It impacts their schooling. They can't concentrate. They miss years. It's very bad for their health. I mean, all kinds of bad things, and it's preventable. So we are running weekly iron and folic acid programs through school platforms. But when we looked at what evidence there would be that would show that their school performance improved as a result of nutrition programs, we couldn't find any. So we couldn't make that case. So there is this wall, but it's a wall we can get over, where if we had the right evidence, we could conclusively make a hugely transformative case to the education community of why nutrition is a core element and an education investment that can't be ignored, that's directly related to school performance. This is something that's solvable. It's right in front of us. I'm excited about trying to solve some of those evidence gaps. And in a way, SRHR too. SRHR and nutrition belong closer together than they are. They're treated very separately, yet many of the problems interact with one another in a way that demands that the nutrition and SRHR community get together and figure out how to do this. You don't have a lot of people who are good at figuring out how to bring communities together. You have people from one community and people from another community who sometimes talk. That's different. Actually, getting down to the nitty gritty of how you plan integrated programs is challenging. So I'd like to see more evidence about that as well. My dream is a world where we think more in terms of nexus, the spaces in between, where sectors can come together, where we have evidence gaps about integration, and also no missed opportunities mindsets. Like, what is that really? It's a mindset where we try to transcend traditionally vertical approaches, like I'm a vaccines person, I only do vaccines, or I focus on nutrition only. Just on the vaccines question for a minute, you think about it. Vaccines don't work as well when they're administered to people whose immune systems are damaged and weak, because they're predicated upon generating an immune system response from an existing strong immune system. I'm not saying vaccines don't work, they work, but they work much better when people are not malnourished under the hood. So immunization and nutrition belong together too. Um, I would love it if we could see all multilateral development banks, including nutrition and social sector operations where it made sense to do so. And there are more education, health, social protection, WASH, and ag programs that have nothing to do with nutrition out there than there should be. And it is possible to close that gap. Brief anecdote, we've been working with the African Development Bank for several years right now with support from Big Wind Foundation and Dangote Foundation to try to incorporate nutrition smart investments in all social sector operations. So they can now track it, they can now measure it, they now have some nutrition outcomes in it as well. And that's the African Development Bank. I'd like to see that at the World Bank, Islamic Development Bank, et cetera. Things are moving. Gavi, similarly, it would be great. And we're starting conversations with them about how to focus on zero dose children, who turns out are the same children that are probably not getting nutrition interventions as well. How we can bring that together. So that's an example of putting institutional interest to the back of the line and putting the people we serve to the front of the line, which is exactly how it should be. So I'm really excited about that too. Global Partnership for Education. Love to see them include nutrition as core, not nice to have. So, I mean, the most important actor in all of this is maybe not the multilaterals, but it's governments at national and subnational level. And I think helping them to recognize that investing in nutrition generates among the best returns possible is a high priority for us. If they recognize that, they would also take the regulatory and legislative action required to shift their food environments, right? So it can't be that we can succeed in the fight against malnutrition if Coke is cheaper than milk. It can't be that ultra processed foods high in fat and sugar that are pervasive and targeted to children can continue to operate in that way if we're going to get ahead in nutrition. So nutritious food has to be cheaper than unhealthy food, or health systems are going to pay the price, as we've mentioned before. And I think governments are crucial to turning that around. And I'm very hopeful that over time that they will. No, in terms of silos, sometimes it's competitive institutional mandates. Sometimes it's the availability of funding and resource competition. Sometimes donor preferences or sectoral boundaries, rather than driven by the best interest of the people they're meant to serve, as I mentioned. So I think if we get that thinking a little bit more to the fore and we take a no missed opportunities mindset, we're going to see a lot more places where we could come together, right? You shouldn't be running a measles immunization campaign and 2 months later saying, oh, we really should have delivered vitamin A at the same time, and then run a separate campaign. But that's happening around the world. So we can bring those things together. And that's why at Nutrition International, we do take a no missed opportunities approach to development. And that's why we're excited to work with our partners and with donors and governments to create greater good for the people we serve. And evidence is a crucial part of that. Thanks, David.
Great. Terrific. Thanks, Joel. You've given us a lot to think about. We've run out of time, but in a short period, you've really given us a whole lot that's extremely helpful. So many thanks. And this wraps up this Evidence Dialogues webinar for now.
Thanks, David. And thanks to 3IE. Take care.